Good afternoon, everyone, and to some of you, good morning. I'm Brenda Morris, and I'm the Director of Produce Safety for AFDO. And on behalf of AFDO, we'd like to welcome you to this webinar that we're hosting for FDA that's titled Cyclospora 101 for Produce Inspectors. This webinar is going to provide you some information, especially for you regulators, regarding this unique parasite, including some best management practices that can be used as control measures. We are excited today to have Dr. Socrates Trujillo as our speaker. Dr. Trujillo is a supervisory biologist at the Office of Applied Research and Safety Assignment in CIFSAN with FDA. He provides leadership, oversight, and direction to staff members on biological research matters, and he works closely with the directors of the Division of Virulence Assessment, the Division of Molecular Biology, and the Deputy Office Director, just to make certain that the research that's being conducted in the divisions is within the parameters needed for supporting all regulatory programs. His career started in 2001 with FDA. He was an original member of the Produce Safety Network, first working at the Southern region and then assigned to the Northeast region. He joined the Division of Produce Safety and helped develop the Produce Safety Rule. I want to remind you or to let you know that throughout his presentation today, if you have any questions, please put them in the chat box and we will allow some time at the end to be able to answer those questions. And so, Dr. Trujillo, I'm going to turn this over to you. Welcome.
Thank you, Brenda. Good morning, and as you said, to some of our colleagues, and good afternoon. As Brenda indicated, my name is Socrates Trujillo. It is a pleasure to be here, Abdo. Thank you very much for the invitation and for allowing me to come and talk to you about Cyclospora cayetanensis. So I'm just going to start right off because we only have an hour, and I'm sure you guys will have a lot of questions, and there's a lot of good information that we would like to share. So first of all, I want to make sure that we all understand why we're here and what we're talking about this specific organism. And for some of you who have been dealing with this parasite before 2018, the majority of the outbreaks we had in the United States were associated to the consumption of produce grown and harvested outside of the United States. So the majority of the outbreaks that we had, or all the information that we had, were for fruits or vegetables that came into the United States, and then our citizens here in the United States consumed them, or were associated with travel, meaning that the individuals consume fruits or vegetables contaminated with this parasite, came back to the United States and developed the disease. So unfortunately, the data that we have now, approximately 2018 and on, we had outbreaks associated to consumption, because the consumption of produce, either fruits or vegetables, that were potentially grown and harvested in the United States, indicating that the source of the parasite was a domestic produce. So right here in front of you, you have some of the information we had captured with the help of CDC, where we had a lot of citizens of the United States who developed the disease, Cyclosporiasis, by consuming domestic produce, either grown and harvested in the United States. So that's something that's the reason why we're having here, and the reason why AFDO allow us to come and talk to you to bring the attention of this specific organism. So that's what I wanted to talk to you, to center you on the reason why we're here. And again, this is a parasite. Cyclospora cayetanensis is a parasite that it was associated, right, with international travel, or with the consumption of produce who was not grown in the United States. However, right, this organism now that produced a disease called Cyclosporiasis, and we are still learning a lot about this parasite. We don't have specific numbers of the infection dose, because everything that we know about this parasite is that with some lab information that we have obtained, and again, based on the numbers that we had detected of this parasite environment, we believe it's approximately between 10 and 100 oocysts that are needed to produce the disease. But that is based on other information that we have with other parasites, because this organism only affects humans, and we haven't been able to obtain more information outside of the human environment, meaning that the humans need to consume this parasite in the infected form to produce the disease. Now, one of the questions that we have, how long can the infection last? And the information that we have, again, can last from days to months, and we can have relapse. There's individuals who actually have had infections through several months, and that is because the treatment that is associated with this parasite, it is a sulfur-based treatment and sulfur sulfites, right? So those individuals who are allergic to these compounds cannot be treated with this specific antimicrobial, so they can have this disease. And another important question or point that we need to address here is that there are individuals who are asymptomatic. They will be exposed to this parasite. They will develop the disease, but will not have any symptoms that they have developed the disease. Or to say, the organism stays in their system. The organisms go through the cycle. That it means that they can produce oocysts, and the individuals will be shedding the oocysts through their feces, but they will not develop the disease. And that's something that we need to pay attention about it. And as I mentioned earlier, humans are the only known host of Cyclospora cayetanensis. Although there's some studies out there indicating that they have detected the presence of this specific pathogen in other organisms, such as birds, there's no indication that the birds develop the disease that is specific to Cyclospora cayetanensis. Something very important that we have to stress here is that Cyclospora, the genus Cyclospora, has more species than just the cayetanensis, but Cyclospora cayetanensis is the only one who produces the disease in humans. So by microscopy, and we can see the genera Cyclospora, but to be able to identify as cayetanensis, we need to go molecular methods because all these organisms look alike or are very similar under the microscope. And the other thing that I need to bring to your attention is that once Cyclospora cayetanensis is in the environment, we don't have much information how to remove it or eliminate it from the environment, right? So all the antimicrobials that we know that are effective for viruses and bacteria are not effective against Cyclospora cayetanensis. So the best way of preventing the presence of these organisms in fruits and vegetables is not introducing it into the environment, right? So, and again, how is it spread is through human feces, right? So one of the biggest questions that we have is that when this organism becomes infected, as is shed by the humans who consume it. So that's the data that we have, is that this organism takes 7 to 10 days in the environment at temperatures around 75 degrees Fahrenheit to be able to become infective, and so to produce the disease in humans. We know, based on the data that we have in the lab, from the labs, is that the humans are going to be shedding the oocysts who are not sporulated, they're not infective. The organism needs to be in the environment 7 to 10 days and then become effective, sporulated. And then when humans consume fruit or vegetables or water that were the oocysts that are sporulated, the sporocysts, then they will produce the disease. So humans are the ones who transfer this parasite through their feces, and soiled hands, soiled clothes, soiled shoes, soiled equipment can actually move the parasite from one location to another. And again, although animals have been associated, there's no proof that they develop the disease, but animals can move contamination as well. So that's something for you guys to pay attention, right? And again, we humans have to ingest this parasite either by water or food that has been previously contaminated by human feces. This is not an animal disease. This is a human disease, right? So another thing that is very important that we have to pay attention, and the reason why you're here, is that although we a lot of scientists are trying to develop methods to link this specific parasite, Cyclospora cayetanensis, we still do not have a real-time genetic subtyping method. Although CDC is working for clinical samples, there's still not a method for food or environmental samples who need to be, who will provide us information to link a food or environmental sample to a clinical case, right? So that's what we're working on, but we don't have a method right now. So another of the things is that we've been talking about seasonality since we started seeing this parasite in our fruits and vegetables. And here in the United States, the number of cases typically rise from the spring to the summer, spring and summer. So we start seeing cases from around May, June, and July in the United States. However, we have been able to detect the presence of these parasites in produce of the months, right, before May and after July. But the peak of the disease, Cyclosporiasis, in this country, in the United States, concentrates between May, June, and July of every single year. And another thing that is important to mention is that here in our laboratories of the FDA, we are developing methods to recover and detect Cyclosporiasis cayetanensis. And the newest method that we developed was for agricultural water. And it was validated in 2019 by a multi-laboratory protocol where several labs were implementing this protocol and to make sure that it was working appropriately by different analysts in different locations. So again, this protocol that we follow for the detection of Cyclosporiasis cayetanensis on agricultural water was multi-lab validated, published in a peer-reviewed journal, and that's the one we use here in our labs at the FDA. And again, as I've been mentioning earlier on, we cannot grow this parasite in the lab. We need to have humans consuming the parasite, and that needs to be sporulated or infective to develop the disease, and then the oocysts go through their life cycle inside of the gut of the human. And then when the human sheds the feces, that's when we have unsporulated oocysts. It is very challenging because, again, we haven't identified any other ways of growing these organisms outside of the human gut. And that's where we are always looking for oocysts so we can continue research and we can continue our experiments to make sure that we understand more about this parasite specifically. So this is very important, again, because we only have approximately 45 minutes for the presentation and hopefully 15 minutes of questions and answers. We used to have this slide that you see right now, one by one, and I will tell you the sentence, and then, this is not true. So we decided to concentrate everything, and there's a lot of misinformation, and it has to do with the way that we believe all organisms that are public health concern behave. So Cyclosporiasis cayetanensis is completely different, right? So it's not always self-limiting. Again, as I indicated before to you all, if you are allergic to sulfuric antimicrobials, then you cannot be treated for these specific organisms, and it's your body the one who needs to get rid of it naturally, and it's devastating. So another thing is that it is not a public health priority. It is here in the United States. It's been a reportable disease since the 2000s. Again, another thing is that, not all stages of the life cycle of these organisms are infectious. As indicated, it has to be sporulated to be able to produce the disease. And so that any other stage of this organism, or the life cycle of this organism, will not produce the disease unless it's been sporulated. And the sporulation happens, the information that we have is between 7 to 10 days at 75 degrees Fahrenheit or above, right? And again, unlike other organisms such as viruses and bacteria, it's not infective as soon as it's deposited in the environment, meaning if somebody is sick, sheds through their feces, and if somebody touches the feces and consumes the feces, will not produce Cyclosporiasis cayetanensis illness. Cyclosporiasis may produce other diseases, but not Cyclospora if the organism has this, or if the individual has this organism in them. And another very interesting thing is that in endemic countries, because humans are exposed to this parasite from early age, it has been considered a children's disease, meaning that because children were exposed to this parasite, then they become asymptomatic through the years. So in endemic countries, they will be identifying the children with this organism on them, and the adults, although may have the organism in them, they are not producing the disease because they may be asymptomatic. So that's what it was identified as a children's disease, but that is incorrect, right? So adults can have the parasite, can be shedding the parasite, may just not be having symptoms, but they are, they're being infected by this parasite. And then again, animals are not a source of the organism. They may move the organism through their system, but we don't have any information indicating the animals produce the disease and the organism replicates on these animals as it does in humans. Another thing that is very critical and important for you who are going to be, hopefully not, but eventually going to places where being associated with contamination of Cyclospora cayetanensis is that remember, yes, is the harvesters or the people who work directly with the fruits and vegetables who may have the first exposure if they have the organism with them to that fruit or vegetable they're harvesting or weeding or plowing or doing what they do with the fruits and vegetables during the process. But anybody who is in the farm environment, even in the packing house environment, can transfer the contamination if they are with the organism with them. So it's very important to identify that individuals who travel to endemic parts of the world where this organism is there and they consume fruits or vegetables or water that are contaminated with organisms and they come back to the United States and they are sharing the organism, they can transfer this organism to the farm environment, even if they are not the harvesters, even if they are not the packers, right? So that's something that we all need to pay attention about it. And I don't know, we heard this, that some places have indicated that Cyclospora cayetanensis can be transferred through the consumption of meat, and again, we don't have any indication. There's no data that's actually happening. Again, it's through soil, to the feces of humans, and that's how this organism is transferred, right? And there's another one that again, as I indicated earlier, we don't have any information that antimicrobials or sanitizers work to reduce the presence of these organisms in water sources. So the addition of chlorine or ammonia compounds to water that is contaminated with Cyclospora cayetanensis does not have an effect of the presence of this organism. And again, water that has the antimicrobial is not going to disinfect produce because again, these antimicrobials that we know that are used against viruses and bacteria has no effect on Cyclospora cayetanensis. And again, adding these chemicals to latrines, and there's no indication that Cyclospora cayetanensis is affected if the latrines have Cyclospora cayetanensis because individuals who are sick are shedding Cyclospora cayetanensis. Again, some of the information that has been transferred indicate that carbon filters are an effective control measure. We don't have the data as yet. Of course, we are doing everything we can to obtain information, working with our partners to see industry and academia, but we don't have any information that carbon filters are going to help us to eliminate the presence of these organisms. And again, because the antimicrobials or sanitizers that we use for the routine cleaning don't have an effect on Cyclospora cayetanensis, utilizing those tools, those antimicrobials, the likelihood of reducing the presence of these organisms is not known. So that's something that we need to pay attention. And again, right, with the normal process that we know of washing fruits and vegetables, we don't have any information that is going to reduce the presence of the organism of Cyclospora cayetanensis if it's present in fruits and vegetables. So again, something that I told you earlier, prevention is the key. Identifying that the presence of this organism may enter your production, in this case, the farmers, not you guys, but when you go into a farm or a packing house, you need to identify the potential sources of the introduction of this pathogen, either on the farm or on a packing house, to make sure that you communicate that information to the farmers. And because once the organism is present in the environment of the farm or the packing house, the likelihood of removing it with what we know right now is very low. And again, I've been talking to you about this here and there, of course, because the sources of this pathogen, specific parasite, Cyclospora cayetanensis, is through feces, human feces. Portable toilets is of concern, and something that we want you as state inspectors to pay attention to when you go into a farm or a packing house. Where is the portable toilet located at? And we will go over each one of those specific potential sources of contamination. But remember, not only the portable toilets are the sources of sewage, right, or human waste. So when you are out there visiting a farm or a packing house, the important part for you guys is to pay attention about all the sources of sewage. And again, of course, because it's human disease, although the produce safety rule does call for to isolate any worker who's ill, just remember there are asymptomatic patients. There are individuals who are going to be sharing the organism if they're exposed to through their feces without any symptoms, right? So that's something that we need to talk about and make sure that we pay attention when we are out there. So we're going to go also the routes of contamination. You need to pay attention about the water sources, agricultural water sources, and distribution systems, right? Because they can potentially be contaminated with human feces, right? So that's what you need to pay attention to. Where is this water coming from? What are the potential sources or indication that may be contaminated with human feces, if that's the case, right? So when you go to a farm or a packing house, you need to see all around and make sure that there's no potential of contamination of that water source by human feces, right? Either the water used for irrigation, the water used for spraying pesticides, herbicides, fungicides, any water used during harvest or prior to harvest, and of course the water used post-harvest, either packing or washing of this produce that you are going to be visiting. Something very important, as I indicated, is humans, is the hygiene of the human. That is very important. The person who's going to be in the farm environment or the packing house environment is not only about their hands, right, but it's also about their clothing, right? Soil, clothes can be a source of this pathogen. So something you need to pay attention to are the boots, all their smocks, the gloves, has to make sure are they reusable, are they properly clean, can they be moving contamination? And something that we used to do before the produce safety rule is because before that, we have to pay attention to the hygiene of the individuals, right? Because they can transfer to the produce safety rule. That's something we need to pay attention as well. But it's how they arrive that morning or that afternoon to do their activities at the farm, the packing house. Why? Because they could be coming from a place where this organism may be there, right? Like in their houses, when we have, people commingling or living in an environment where there's a lot of individuals who one of them may be sick and not have good hygiene and having soiled clothes arriving to work, that's something we need to pay attention to. And again, tools and equipment. Why? Because if we have soiled hands and then we start moving and we don't wash our hands and we touch stuff and then we leave it without being properly cleaned and sanitized to the temperature of 75 degrees Fahrenheit, and if we are shedding oils, we will be then contaminating that tools and equipment and allowing the organism to survive. And again, and think about potentials of cross-contamination, right, between produce and food. And that's something that you need to start thinking about when you visit a farm or a packing house. So this picture here, it is a well. it is properly surrounded. You don't have to see a well like this to say, oh, this is a good working well. However, it is important to pay attention how a well will actually be protected from the exposure to pathogens, specifically Cyclospora cayetanensis, with only authorized individuals will have access to. They're properly clean and can be properly maintained, right? So then, although we have wells where the actual area is cracked, if we are not protected for intrusion, and again, remember human, if anybody comes here with salt hands or does there's defecation around the area and there's water and there's move, so we can move the contamination directly into the water source. And although, well water is supposed to be, free of contaminants and clean, when it's drawn, properly drawn from deep waters, if we have cracks and if we're not maintaining our well properly, then we can introduce this specific pathogen. And although some individuals like to shock the water with chlorine, the well, in this case, Cyclospora cayetanensis will not be affected. And if we're introducing this pathogen to the water, then we are distributing the pathogen through our use of the water, either for irrigation or for pesticides or for post-harvest activities. Right. Another thing is that you need to pay attention to when you are visiting your farms is how are this water coming? Where is the water coming from? In this case, we can, these individuals, you can see here, there is the pump here, and there's drawing water directly from the river. And as indicated, even you chlorinate, the farmer chlorinates water or use carbon filters, the likelihood of moving contamination from the water, in this case, at surface water, through our growing area increases, right? Because the surface water in Cyclospora cayetanensis will not be reduced or eliminated with the presence of utilizing antimicrobials, or if we filter, or water because of the nature of the parasite. Again, so parts of where we visited, they will be drawing the water from the well, and then they put in reservoirs waiting for being utilized for irrigation, and they will be treating them with some chemicals, but those chemicals do not have an effect on Cyclospora cayetanensis. And again, not having an area that is going to, hold the water, that is going to be utilized for irrigation purposes or any other on the farm or the packing house that is open to the environment and any individuals can walk in, will also potentially be a source of contamination. So when you are out there, going to the farms, going to the packing house, always try to pay attention. Is humans are going to be able to somehow have access to our sources of water who should not be unauthorized individuals. That's what you need to think. And again, right, because of the chemicals, again, if we use chlorine or ammonia compounds to treat our water, and the water may be a source of Cyclospora cayetanensis, then these chemicals and antimicrobials will not have an effect on it and will be distributing this pathogen if the water is contaminated to our fruits or vegetables, and then potentially staying 7 to 10 days, even if they're unsporulated at 75 degrees Fahrenheit, then the sporulation occurs, they become infective, and any individuals consuming those fruits or vegetables will be developing the disease. And remember, with the information that we have, 10 to 100 oocysts are enough to produce the disease. And something that I forgot to mention earlier is that individuals who are exposed to the parasite, who are can shed up to 300,000 oocysts per evacuation, right? So that's something that you have to think about when 100 oocysts only will produce the disease in humans based on the numbers that we have detected. When you're out there, see the behavior of the individuals during harvest. How are they doing it? And this specific picture, something you need to pay attention to is that there is an individual walking on this harvesting machine on top of this produce right here. And if the individual walked through a field that potentially could have had human feces, right? So even though they may not be harvesting around the area, individuals who walk through could have moved the contamination to the machine, and they standing on top of the machine where the produce is growing through, maybe moving contamination. And that's something that you need to see. And one of my colleagues, Crystal McKenna, from the Office of Compliance here at CIFSEN, always says, observe the workers, see how they're behaving, where they're moving from one location to another, and where they can be potentially exposing the produce to a specific pathogen. And in this case, if the pathogen Cyclospora cayetanensis makes it to the fruit and vegetables, the likelihood of removing it from it is very minimum. Again, when you go out there and go to a packing house, pay attention to the sources of water. Find out where the water is coming from. How are they making sure that it's not being exposed to a pathogen, specific Cyclospora cayetanensis? Because again, remember, antimicrobials will not reduce the presence or will not have an effect on the infectivity of the pathogen. So you need to pay attention, make sure that you are asked the proper questions to the people who are doing the activities on the packing house, washing or packing. Remember, this is a real picture that we took when we went into a visit where the sources of water, yeah, it's murky. Yeah, there's supposed to be soil. Yeah, you need to ask questions. How often do you change this water? How did you know that it is not going to be a source of contamination? And remember, adding antimicrobials will not reduce the presence of this pathogen from it. And again, right, it is what's happening around it. You know, where this broccoli going to end up? Are they really going to be disposing it? How are they cleaning, sanitizing the beans that are used for harvest and for moving? And then remember the source of water. Let's go back to the source of water and also the individuals working on this environment. Now, when you're out there, you need to start thinking about, okay, what am I going to ask? What am I going to pay attention to if I'm going to be visiting a farm or a packing house? Always going to the agricultural water, the source distribution system. Start asking yourself, as I indicated, is it potential that my water will be contaminated with sewage or from latrines? Is there anything that is going to affect that the water as humans going to be contaminated the water somehow? Do they have access to the sources of water? And how the farmer or the packing house owner are making sure that those sources of water are protected from human feces, because that's where it is, sewage or anything that can be potentially contaminating. Again, the sewage systems, in your farm, in the farms that you are visiting, or the packing houses, how are they maintained, right? If there's any spills, how to make sure that those spills do not affect the source of water or the operations of harvesting and or post-harvest activities. Do they make sure that if there's any spill or leaks, do not contaminate or prevent any contamination? Do they document those things so you start getting all the information? And in some parts of the United States, there's floodings and earthquakes, and if there are sewage plants by these farms or packing houses, do they have a plan to make sure that that the source of water of the place will not be contaminated with sewage, right? So those are the things, the questions you need to start asking when you're going to be visiting. But again, right, the good neighbors. So what is next to the farms, around the farms? Is there anything that can be a potential source of contamination for this specific pathogen, the parasite, right? Are they applying, biosolids to the areas around the farm, even though they're not applied directly on the produce that they're growing? Are biosolids being applied by the farm, right? As their biosolids are, potentially contaminated the source of water? Are we using water that is being used also for recreational activities, right? And that's something that you have thinking about when you're going to be visiting your farm. And again, we go back to toilets and hand washing facilities. How do they maintain them on the farm, the packing house? How they're properly clean and sanitized? How frequently do they do it? What happens with that waste? Where does it end up? right? Who does that? How do they make sure that that waste that came out of the toilets will not end up on my farm environment, either to the water or the packing house. And again, the individuals who are going to be cleaning or removing the waste from a latrine are going to be specifically dedicated to that, or do they have other activities on the farm? They go and empty the latrines or the porta potties, and they come back and do another activity on my farm without changing their clothes or we're taking a shower. And so all the things that you need to start paying attention to when you're visiting. And again, it's all about the employees. What are we talking about here? Who's working? What are they doing? Are they washing their hands when they really go to the toilet? What is going on when they wash their hands? And we continue to talk about washing hands. But it is, are we observing how they're doing it? Are they properly trained and do understand why they actually have to wash their hands after using the toilet and before going to any activity that is going to be exposing produce to their contact, right? And again, as I indicated to you earlier, it's not only the harvesting people or the people who does touch produce or packaging, right, or packing. How about visitors, right? How about any other personnel who works in the fire environment, either at the offices or the packing house, that have potentially traveled to a part of the world where this contamination is endemic, and then come back from their travel and there potentially can be having the parasite with them and then transferring the parasite to the farm or the packing house environment, right? So, and again, we keep on reminding everybody and you or colleagues from the States, ask questions about how do they treat the individual who are sick, right? Do they allow them to go to other places? Do they have sick leave? Can they honestly be ill and not work? And do they have treatments? Because in some locations, the farms may have a medical clinic, and they will be treating the ill on site. And that's the information that you need to ask when you're out there interacting with the farmers, or on the packing house. And again, as I indicated, clothing is very, very important. How are they potentially moving contamination from one location to another, to their boots, to their clothing, to their gloves? And again, we were talking about, if gloves are reusable, how they're properly cleaned and if necessary, sanitized. Are they even being properly cleaned if they're touching areas that can potentially be contaminated with Cyclospora cayetanensis? Are we using water to clean our boots or clothing? Could they be a source of this specific parasite, right? So all these questions that you need to ask and start putting the picture together. What are the potential sources of this contamination, right? And again, tools and equipment, as I indicated, if I have soil hands and if I put these tools and equipment on areas who can be contaminated with human feces, how are we going to pay attention to that does not occur, right? So remember, we can be having soil hands, touching the tools and the equipment, and then leaving that equipment without being properly cleaned, and then sporulation may occur, and then transferring that contamination from the tools and equipment to the fruits and vegetables that are going to be consumed, and then the cycle continues. And again, one of the things but it's not only about, oh my God, this is a problem, right? But what can we do, right? So when you talk to your farmers, to the packing houses, you need to make sure that they understand that Cyclospora cayetanensis can be present in the pre-harvest, the harvest, of the post-harvest environment. So that's something that you have to make sure you talk to your farmers that antimicrobials do not help us here, right? So they need to understand what is the water system, where is the water coming from, how can potentially be contaminated with this specific parasite. through landfill, sewage, or septic systems. What is the likelihood of that occurring? And how can we reduce that for contaminating my produce when I'm working on the farm? And again, monitor the microbial quality of the microbial quality of the water to make sure that there is not a source of contamination, and that's very, very important for farmers to do, as well as the packing houses. And again, if there's an area where Cyclosporic cayetanensis have been detected and potentially for water, identify where that source could happen, right? Is it an ongoing source? Is it because my water is constantly being contaminated with human feces? Is it possible there was a single occurrence? They start working to try to implement a root cause analysis. Talk to your farmers about it and say, okay, but if the contamination, what could happen? Can they change the water source, move from a surface water to a groundwater if possible? And that's some of the things that you need to talk to your farmers about, right? And if the water cannot be transferred, can we do something to make sure that that water doesn't end up contaminated in the produce that is being grown on the farm? And of course, we cannot use water that is contaminated on a packing house because we already transferred the contamination. So some of the things that you need to start thinking about when you're going to be interacting with your farmers when you are talking about the presence of this pathogen. Then again, right, if the water is a potential source of Cyclosporiasis cayetanensis, you need to make sure that the farmers understand that if the water touches the edible portion of the crop, that specific product may be considered adulterated, right? And we need to talk to them and make sure that they understand we may need to be changing the method of application of the water so the water doesn't touch the edible portion of the crop. And again, and if that's the only source of water, we need to make sure that our workers do not use that water to either wash their hands, clean the cleaner, or any of the tools, and of course not to consume it to drinking water, right? And remember, because up to now we don't have any antimicrobial who's going to reduce the likelihood of this pathogen producing diseases. So we want to make sure that we need to be a preventive approach, right, instead of a reactive, because the reactive is we have a problem of contamination. And again, pay attention to your farmers, to your workers, talk to them, indicate health and hygiene is important. We need to educate them of hygiene practices during the pre-harvest, the harvest, and the post-harvest activities. And again, symptoms, diarrhea is cramps, headaches, and again, do we have any potential symptomatic carriers? That's something, and it has to do with individuals coming from endemic parts of the world where this illness is present all the time. And again, we need to seek diagnosis and treatment if we have identified individual who can be sick with cyclosporiasis. With waste management, make sure that the farmer knows where these toilets are being cleaned and properly sanitized, where is the waste being eliminated, what's happening to it. And again, right, we need to make sure that there is a plan to reduce the likelihood of sewage spills or leaks. And if there's any, to make sure that sewage spill or leak doesn't end up on the sources of water or on the produce itself. Now, something that you need to know is our offices at the FDA or centers in the Office of Regulatory Affairs are working together to develop a specific farm investigation questionnaire to Cyclospora, that in case that some of your work ends up identifying a potential source of Cyclospora cayetanensis to a farm where you work with, that they are developing this questionnaire to try to identify potential source of contamination, routes of contamination, and any weather or event or any previous illness that will allow us to put together a better picture to find out what could have happened that ended up contaminating our produce with Cyclospora cayetanensis. Also involves any effects on environmental conditions, the source of agricultural water, and very, very important, employee hygiene, again, because this parasite specifically is based on humans, their behavior. And again, when you are going to be working with your 4056 or with your own forms, when you're going to be doing inspections on your farms, all these parts that you see here, so parts of the produce safety rule, are citations, potential citations, where you can identify if you see any violations of the produce safety rule, that it will end up in a contamination of potential contamination of Cyclospora cayetanensis. Of course, we're talking about Subpart C, that is training. 112.22 indicate that the individual must be trained on healthy hygiene and in conducting their covered activities. So that's something very important. If you're out there and observing that the individual don't know what they're doing, or don't have any basic concepts of health and hygiene, you can make that citation there. Of course, Part D is specific hygiene practices, and so something else, how you're going to be contaminating the covered produce. Although, again, Subpart E is spending, that's a source of water. You still need to make sure the farmers understand that water may be a vehicle for the contamination of produce. So they need to pay attention specifically on the microbial quality of the water. Of course, Subpart F, although that's for biological supplement of animal origin, and we know that human waste is biosolids, and the only way that we can apply biosolids is by following the EPA regulations. You need to find out what is going on around the farm, and are there any biosolids being applied who may not be Part D, I believe, for the EPA regulation. Again, anything that's being harvested that can be contaminated with human feces should not be harvested. So that should be Subpart K. And then again, cleanliness and properly sanitation of equipment and tools. That's Subpart L. How they, cleaning the toilet facilities, the hand washing facilities, how they treat the sewage and the plumbing, right? And I'm going a little bit fast because I want to make sure we have time for questions and answers. But again, right, we are working very, very closely with our Office of Compliance officers at the agency. And you have any questions, you can always contact your Office of Compliance at the district that you belong to, or your own Office of Compliance personnel at your state level. In the agency, where finding Cyclospora cayetanensis indicates direct or indirect contamination with human feces, as I indicated, because the only source of this specific pathogen is human feces, right? And then that makes it adulterated under the Food and Drug Cosmetic Acts, FDNC, and our Office of Compliance has indicated that if we find Cyclospora cayetanensis on produce, then it is at DNC 402A for charge, because it's been prepared, packed, or held under unsanitary conditions, right? And so if there's the presence of the parasite, the produce should not be distributed and should be recalled if it's in distribution, and it should be destroyed because there's no reconditioning. And this specific organism will not be eliminated unless it's destroyed. And again, if you need to talk to your Office of Compliance or your program manager, in case that you have been you have identified a farm that can potentially be associated to the presence of Cyclospora cayetanensis, or you have tested and you have this pathogen of the samples that you have tested. And however, right, we have a lot of questions, right? There's a lot of information that we still need to find, and that we are still looking and working with all of our partners in industry and academia. We need to, can we identify control measures to eliminate Cyclospora, right? Can we develop better tools to genetically link the cases from clinical samples to food environmental samples? As I indicated, we believe that 10 to 100 oocysts are required to produce this illness in humans. That is based on other parasites and some of the information that we have by sampling produce in all waters, produce. So we don't know a specific the infected dose, and we have a lot of questions about that. And again, we don't know the prevalence of this specific disease in the United States, because as you know, a lot of individuals may not seek care, so they may be either getting their disease, going through the disease by themselves, or maybe asymptomatic carriers and wouldn't even know. And again, as I indicated, the seasonality of infection, we still don't know much. We just know that the cases increase from May to July, but there's a lot of information that we don't know that we would like to find out more about. And again, we don't know if we have Cyclosporiasis cayetanensis in the food, in the water on the environment from the United States. We're still looking for a lot of information. We have, we are working very, very diligently to, try to develop a more specific methodology for the detection of this specific parasite on wastewater treatment plants, to see if the wastewater treatment plants are really effectively eliminating this specific parasite from those sewage or those waters who are going through the treatment. We are extending the matrices for the detection of this parasite in food. That's the FDA Van 19B. Currently, we are doing a matrix extension for complex matrices. We are developing a methodology for the detection of this specific parasites in soil samples. And we are improving or developing and improving the methods for genotyping this parasite, as I indicated, to link the presence of this parasite from food or environmental samples to clinical samples, right? Working with CDC about that. Something that you need to know is that we have posted already online how to collect water utilizing that ultrafiltration. The methodology requires 5 what we call subsamples, 5 filters of 10 liters each, meaning that we pass 10 liters per filter, and every 5 of those becomes a sample at the agency. And that's how we actually are collecting. And that's based on the research that our researchers, Dr. Da Silva, has done for the development of this method, and Dr. Durigan. And again, we filter on this ultrafiltration filters, and then we retrieve that sediment, and then we look for the presence of the parasite. So something very important is that because we're filtering, if the parasite is not intact, we cannot detect it, right? So when we find a positive from our water samples, is because the oocyte was intact when we were filtering it. We have videos in English and Spanish about how to do this filtration. And then you can follow the 19B, well, the 19C for water. That's the method that we have at the agency. And as I indicated, we're developing the soil samples, so we are working on that. So you all are going to have this presentation, I believe. That's very, very important. We have the resources. Here we have fact sheets, and I know Brenda Asdo has created a document also specific to Cyclospora that she's going to mention. And we are currently developing a Cyclospora prevention plan that you all will have access to. That it's all the activities that we're doing at the center, at the FDA, to make sure that we gain as much information as possible on this parasite. And Brenda, if you have any questions, then I can entertain them. With me are going to be Dr. Crystal McKenna from the Office of Compliance, and Ms. Fasila Shakir from the Center, the Division of Produce Safety, to answer questions with me as well. So thank you, Brenda.
Thank you, Dr. Trujillo. Wow, what a lot of information, a lot of great information. So we're going to answer a few questions that are in the chat box. Remember, if you have a question, stick it in the chat box so that we can get to it. And so let me get to the first question. So the first one that we'd like to do is, does this parasite thrive in coolers with low temperatures?
Brenda, thank you very much. So the information that we have from the labs, the studies that we've done, is that this parasite needs to be around 7 to 10 days on temperature 75 degrees Fahrenheit. But something that our researchers in academia have indicated, once the sterilization starts, we believe it doesn't stop. So meaning that this parasite may not need to be 7 to 10 days to 75 degrees Fahrenheit to be fully sporulated, indicating that if they were exposed and the sporulation started, if we move it to a cooler environment, the sporulation will continue. It will take longer, but it will continue. So yes, again, we need more data. We are trying to develop the experiments to answer that specific question. But the indication that we have is that those cooler environments, if the sporulation already started, it will continue. Yeah, I hope that answers the question. I don't know, Faz, is there anything I was missing that you would like to contribute if you're listening?
No, nothing to add, so thanks.
No.
Okay, our next question. In your investigations of outbreaks, either domestic or internationally, have you tested and found Cyclospora oocyst on harvest equipment?
Well, that's very good. So all this information that we indicated is moving the contamination. I have not, and I'm trying to think if any of my colleagues from Office of Regulatory Affairs have ever sampled that specific for Cyclospora cayetanensis, is because all this we're learning about it, right? So we do not have much information about it because we were not centering of sampling the specific tools and pieces of equipment. It is more like a prevention that we want the attention to be discussed too. Because soil hands will be moving the contamination. So we want to make sure that the issue here is the human soils, so that if there has soil, they will be moving the contamination to the tools and equipment. But I do not know anyone who has been testing it for us, but it's more like a preventive approach.
Hey, Socrates, can you hear
Yes.
me? Yeah.
Yes.
And I did also, I responded, sorry, and it responded as your name, but I also mentioned, my understanding is we really don't have a method to test food contact surfaces for Cyclospora. So I think that's another limitation. Currently our methods
Correct. Thank you.
to water and produce.
And food. Thank you, Faz. Yes. On top of it, yes. But that's a good point. Let me write it down because I think that's the next thing to do, right?
Okay. And we have another question. So has FDA done a survey of portable toilets on farms associated with outbreaks?
No.
We know that there is the CPS research study being done by CDC now that involves this, but just wondering, is there any kind of historic data?
I know, Crystal, this is very close to your heart because you've been asking the same question over and over and over. But just remember, we don't have any jurisdiction over the toilets, right? And human feces. We don't do that studies. So we don't have currently any information. But we know industry is doing that type of work, and we know, of course, CDC is working on that as indicated on the question. But we currently don't have any information unless I'm missing anything. Crystal or Faz? I see you unmuted, Crystal. We don't hear you. You may be double muted. Okay.
Okay.
Anyway, so if you have another question, we can get Crystal later.
Let's see. I don't have any more. We have no more questions. This is your last chance. If you'd like to ask a question, drop it in the chat box for us.
But again,
I have one. So will there be any work to see if drinking water treatment plants are able to remove Cyclospora?
I do not know the answer to that question. Fas?
Yeah, I mean, I would say one area that we are interested in is looking at wastewater treatments and seeing how effective they are at eliminating Cyclospora. I believe this was a topic that was discussed at the GIFSI and Cyclospora meeting that was held 2 years ago, I think at this point.
Mm-hmm.
Yeah, and it's still on our radar. But
For drinking
water, I mean, in discussions with CDC, based on the pattern of and the distribution of cases within the US, they don't believe that it is a drinking water problem. They continue to believe that based on the distribution of cases and the epidemiology, that it is a foodborne issue in the US.
Thank you, Fas.
Okay. Any more questions?
There's one thing.
Here we come. Here we go.
Oh.
I'm sorry, go ahead.
Yeah, if I could just mention one thing, Brenda, because I know we're about out of time. If there's one more question, I did want to mention that FDA is working on a comprehensive Cyclospora plan, and that will be issued soon. And we do look forward to engaging with AFTO and the states and others to discuss the plan in detail.
Okay. I have two more questions, if we can do those very quickly. The first question is, given climate change and decreasing aquifer levels nationally, is it unreasonable to think that we can move away from surface water use in agriculture? Although we'd love to address septic issues nationally, this is beyond the control of farmers and is really something that needs to be prioritized. For water use risk reduction, it seems encouraging water use that does not contact edible harvestable portion of the crop makes sense, or early in crop production prior to fruit set.
So, okay, remember, the information that we have was because other parts of the United States are utilizing gray water for agricultural purposes, and the information that we had was with other specific organisms that the wastewater plants were actually being treated enough to remove other parasites, but we never asked the questions about Cyclospora cayetanensis, right? So now we're going back to ask those questions and work with the wastewater treatment plants to make sure that the treatments that they're doing reduce the presence of this parasite if present on those gray waters, right? So we're working with our colleagues of CDC and EPA to make sure that, yes, the utilization or reuse of water does not pose a concern on our farmers and the health of the consumers in the United States. But yes, we are engaged in conversations with all the fractions that help us to protect the public health. And I know it's all the information that's what it boils down to, right? Preventive.
Okay, and then the last question we have is, public water systems are looking at using lakes and streams to supplement water from wells that are not keeping up with the demand. How significant is this decision if it's 20%?
Well, again, it has to do with the potential of contamination by human feces or sewage or any spills or biosolids, right, to those sources of water. So again, the problem is not the water, right? The problem is the activities around the water and the potential exposure to this contamination. So that's why we wanted to bring this information to you all, to start asking these questions and try to bring the attention to a potential contamination of any surface water and any groundwater, because it's not properly maintained, and again, you know, the presence of ill workers. So again, the problem is not water, right? The problem is the activities. The problem is the exposure. The problem is not knowing where this water is coming from. And that's what we wanted you to all pay attention to and ask those questions when you are out there trying to find out how we can prevent this organism for entering the food chain supply. Okay.
Well, I want to thank you so much, Dr. Trujillo, for this great information on Cyclospora. And we thank you, for your time today. I do want to let everyone know that AFDO recently released the document titled Investigating Cyclospora. And you can find this on our AFDO website. We're also going to include this in our email link that will come back to all the participants, that will also direct you as to where this webinar will be located on our website in case you need to review it again or want to share it with someone else. But again, thank you so much for taking part in our webinar today, and we hope that you have a great 4th of July weekend. Thank you, Dr. Trujillo.
Thank you, everybody. Stay safe.